Let's understand what are the interim nitrosamine impurity limits. You might have heard this term many times. So this video is to understand these nitrosamine impurity limits in detail. This will be a short video and I will explain regarding the interim limits. So these interim limits, as the name indicates, these are the temporary limits, and understanding temporary allowable limits is important for us as uh, we are in the pharma field, and we should know the exact understanding, exact meaning of these limits. These are the temporary limits provided by the regulatory authorities like FDA, EMA, and other regulatory bodies or health authorities. And these interim limits are the temporary allowable levels or temporary nitrosamine impurity levels or limits, so that the products can be manufactured and distributed. Otherwise, if the manufacturers found some nitrosamine impurities or NDSRI impurities, and if there is no established limits, so how the manufacturer will deal with these impurities? These are established while manufacturers work toward the permanent and lower acceptable limits. These are set by the regulatory agencies like FDA, EMA, ANVISA, and many others. The purpose of interim limits is to allow continuous production and distribution of essential medications. It provides time for manufacturers to investigate and implement mitigation strategies, and it ensures patient safety while long-term solutions are developed. Many times you may get information regarding the interim limits for some products. These interim limits are developed so that there should not be a shortage of the medicine in the market. If the medicine or formulation get short in the market, then the patients who are taking or who are on the medication with those uh, formulations, they will be at the risk. So these interim limits are developed, and these are given or these are set by the regulatory authorities so that there should not be a shortage of the medicine in the market. This happened with sitagliptin tablets. This happened with vernicillin tablets. The nitrosamine impurities were there in the sitagliptin formulation, and USFDA has given some interim limits which were higher, and these limits were for the short-term treatment, so that the patient will get the continuous supply of medicine and there will not be a risk to the patient health which are on the medication because of the shortage of medicine due to these nitrosamine impurities and their limits. Now, basis for setting interim limits. How the interim limits are set. First is risk assessment approach. Limits are based on the carcinogenic potency of the specific nitrosamine. Consideration is given to the maximum daily dose of the drug, and also the uh, treatment time, whether it is for short term treatment, whether it is for long term treatment, that is to be considered. Also, the interim limits are set considering the risk of the carcinogenic nature. Sometimes surrogate impurities levels are also considered for setting the interim limits. There are regulatory guidelines for these limits. Agencies provide guidance on acceptable intake levels of different nitrosamines. Limits may vary depending on to the compound toxicity and the patient exposure duration. That means the treatment duration, whether the product is for short-term duration, whether the product is for long-term duration. If you remember, the less than lifetime approach can be utilized here to have some interim limits for some of the nitrosamine and NDSRI limits. Time frame and compliance. So time bound nature of interim limits, regulatory agencies set the deadline for achieving the final lower limits. Manufacturers must take action within the defined period to comply, and if the manufacturer doesn't comply, then those products are not entered into the market. Steps for compliance. First is to identify sources of nitrosamine contamination, optimize manufacturing process to reduce nitrosamine formation, submit the progress report to regulatory authorities. So what type of steps the manufacturers are taking to meet the stringent limits, those are required to be communicated with the regulatory bodies. Monitoring and corrective actions. So continuous monitoring will be there. Manufacturers must conduct regular testing to track nitrosamine levels and implement robust quality control measures to prevent excessive contamination. It is not like that once the regulatory body has given some limits which are higher and the manufacturers are continuously sending the higher nitrosamine level batches. It should not be like that. Corrective actions: modify synthetic process to minimize nitrosamine formation, improve raw material selection and supplier controls. You can reformulate some products. You can use some antioxidants. You can use some basifying agents to reformulate or decrease the level of impurities. Implement advanced analytical testing methods to detect and control the impurities. And the goal of these interim limits and the nitrosamine reduction is to ensure that nitrosamine levels are reduced to permanent acceptable limits for the patient safety. The permanent acceptable AI limits for nitrosamine are calculated and finalized based onto the cancer risk, that is based onto the potency of the nitrosamines, and also the time period of 70 years, that is lifespan, is considered, and the risk of 1 in 1 lakh species is considered after the extrapolation. So that is a different part. Just I have uh, 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 provided you some information here. So permanent limits are required to be set in some time period. This is the information for interim nitrosamine limits. Thank you for watching the video.